So, good morning to all. So, we are going to cover the lectures on learning theories, and this will be the first lecture. We will have four lectures on learning, and the first one we are starting with behavioral learning theories. In introduction, a person's response that are not inherent to its biological makeup are classified as acquired or learned behavior. The traits which is not directly linked to the genetic factors and biological factors that you acquire from learning through your experience in and other means is called as learned behavior. Learning can be characterized as a process through which an individual undergoes modification, often enduring. Enduring means long lasting, based on interaction with the surrounding environment, personal actions, and observations. So we used to learn from various factors which are there around us, like environment, personal actions, and observations. We first learn to respond simply to immediate thing around us in the initial phase of life, like pulling away from painful experiences before they happen. So, in early childhood, we develop many motor skills such as reaching for and holding objects and standing without help. We also start to learn how to speak. As we gain these motor and verbal skills, we improve our problem solving abilities also. We learn about ourselves and our surroundings. This shows a gradual shift from basic learning to more complex learning. We are also discovering how to learn effectively. Different types of learning happen at the same time and are closely connected and dependent on each other. So various theories of learning, one theory is not always acting upon, various theories of learning acting simultaneously and are dependent on each other. So further, we will get to learn about the connectionist theory, classical conditioning theory, and Skinner operants conditioning in the brief. And we will learn how these learning principles shapes the human behavior, may be positive or negative. Starting with the connectionism. Connectionism was given by the Edward L. Thorndike, and he was a psychologist in US known for his learning theory called connectionism. He focused on education basically and particularly on learning, transfer, individual differences, and intelligence. He used experimental methods to assess the students' achievement results. His influence on education is recognized through Thorndike Award, which is given by the American Psychological Association for Teachers. He suggested that basic kind of learning is about creating links between what we sense, means what how we perceive the things, and how our brains act on that response. He thought that learning usually happens through trying different things and figuring out what works. So one of his theories, trial and error learning. In a typical experimental situation, a cat is placed in a cage by him. The cat can open an escape hatch by pushing a stick or pulling a chain. So cat was placed in the box and there was a chain and there was a push button by pressing or pulling of which the cat could escape. So after a series of random responses, the cat eventually escapes by making a response that opens the box. The cat then is put back into the cage. Over trials, the cat reaches the goal quicker and makes fewer errors prior responding correctly. Learning through trial and error happens slowly as we keep what works and let go of what doesn't. So, if you try for some experiment or some kind of learning in your life, if you do experiments, then out of 10, maybe one will successful, and out of 10 experiments, you will find one experiment will give you the results. So in connection with the psychiatry and clinical psychology, this is happens in substance use disorder also. And one should know that the basically initial consumption of substance is not very much enjoyable. It is felt like discouraging, and after repeated attempts, that substance can can give that effect which is considered as pleasurable to the individual. He also gives the law of effect. The law of effect is when a response leads to a positive outcome in a specific situation, it is more likely to happen again. If the result is positive, then one will do the behavior again. On the other hand, if response is results in negative outcome, it is less likely to be repeated in that same situation. So it is it can be correlated again with the substance use disorder. So many persons tries it, but not always all the persons are get dependent on it. So this law of effect has main two ideas. The law of use states that responding to a stimulus make the connection stronger, and law of disuse says that if there is no response to the stimulus, the connection becomes weaker and may be forgotten. So positive feelings such as reward and praise by someone else make stimulus response links together, and negative feelings make them weaker. The other principles of Edward Thorndike was law of readiness, which states that when one is prepared or ready to act, to do so is rewarding and not to do so is punishing. So the act is rewarding or punishing, one has to uh, taken in account and to become ready to act further in the future. When one is prepared to learn a specific skill, like facing say, social situations like uh, coming onto the stage, performing something on the stage, or other social situation in which one like to face, based on their development of previous knowledge, they have previous knowledges, action that supports this learning will be beneficial. However, if one is not ready or lack the necessary skills like knowledge, oration skills, or communication skills to face the social situation, they trying to learn can be frustrating and unproductive for them. The principle of associative shifting. The concept of associative shifting describes how reactions to one stimulus can eventually transfer to a different stimulus when there is a slight change in the original stimulus over time. For example, to help intellectually disabled person how to learn how to wear a trouser, first start by teaching them to hold it in the right way in the orientation of left and right, then slowly demonstrating the further steps like putting leg into the leg one by one, the chaining, buttoning, and wearing belt in the last. Further, in other principles, the principle of identical elements that affects transfer is generalization. Training in a specific skill does not necessarily make someone better at the skill overall. For example, wearing trouser won't help to learn how to wear a shirt. To help learn, skill should be taught using various type of educational materials. So his work was basically in the education. So he gave the principles of teaching, and he gave form habits. Do not expect them to create themselves. Beware of forming a habit which must be broken later. Do not form two or more habits. One will do as well. So one type of problem solving skill may fit to the one student. Other thing being equal, have a habit form in a way in a which is to be used. Now coming to the classical conditioning you may have know it was given by the Ivan Pavlov, and it involves forming an association between events in the environment and our behavior. For example, our stopping at a site of a red traffic signal is an example of conditioned response. There are terms which classical conditioning covers is unconditioned stimulus, unconditioned response, conditioned stimulus, and conditioned response. The unconditioned stimulus is the stimulus that unconditionally, naturally, and automatically triggers an unlearned response. We will discuss in the further slides by means of the picture. Unconditioned response is naturally usually unvarying response evoked by a stimulus in the absence of learning. So unconditioned response is triggered by the unconditioned stimulus. There is a conditioned stimulus, a previously neutral stimulus that after repeated association with that unconditioned stimulus elicits the same response affected by the unconditioned stimulus itself. And the response which is unconditioned is a new or modified response elicited by a stimulus after conditioning. So we will learn what is this stimulus and responses. So you can see the picture in the left side, but you may not be able to visualize. I will explain the picture. There is a dog and the food. When the food is presented to the dog, this food is considered as unconditioned stimulus, which is natural and which gives the response of salivation in the dog. So this salivation, because of the food, presentation of food is unconditioned response. Further, what happened is a whistle was blown and it was seen that whether salivation occur or not, there was no salivation. In the third step, the food and the whistle was applied together simultaneously and there was salivation. And after repeated attempts of this third step, when food was removed from the stimulus, even the dog started salivating because of the conditioning of this whistle with the food. So this is classical conditioning. So further, there is a term is extinction. Repeated non-reinforced presentation of the conditioned stimulus means repeatedly presenting the whistle only for further period of time will keep the response in extinction phase. The another term is spontaneous recovery. It happens after a period when conditioned stimulus, that is whistle only, is not shown, leading to a presumed extinction of conditioned response, which is salivation with only whistle. If the conditioned stimulus whistle only is presented again and again and the conditioned response reappears, we say that this conditioned response has a spontaneous recovery from extinction. This happens after the extinction occurs. Again, the experiment is done with conditioned stimulus. The spontaneous recovery of salivation occurs thereafter. So this is the same figure. Now you can see clearly there is food and response of salivation. There is a whistle and there is no salivation. Whistle is added with food. The response is salivation, and after repeated experiment, only whistle was blown, and one can see the salivation as response. There is a term generalization refers to idea that conditioned response salivation with only whistle happens with stimuli that are similar to the conditioned stimulus whistle only. If you give the similar type of stimulus like whistle, one can give metronome or clicking clocks or timers which have similar kind of sound can produce the same response of salivation. This means this is generalization of conditioned stimulus. So the dog can have salivation with clocks also, with timers also, and with metronomes also. Now discrimination. Discrimination is opposite of generalization, where the person is able to discriminate between the various kind of stimuli. To tease this, researchers might connect the specific stimulus with unconditioned stimulus while showing other similar stimuli without the unconditioned stimulus. Now the metronome will be produced with the food and other stimulus will not be produced with the food. So the person or at this time the dog can differentiate between the type of stimulus. There is higher order conditioning also. In higher order conditioning, one can see the explanation in the picture. There is a electric can opener. This is conditioned stimulus applied with food. In this experiment, in the next step, the electric can opener was added with the second order stimulus and salivation occur because of this can opener. Now in third step, the can opener and food were not produced and the only this cabinet door sound was produced, and this also caused the conditioned response which is salivation in the cat. This is second order. The first order was the can opener, the second one is the squeaky cabinet door. This is the another example of emotional reaction because of the conditioning. What happened in this experiment? Albert was an 11-month-old infant who showed no fear of the white rat. There was no fear because of the white rat. And during conditioning, a hammer was stuck against a steel bar behind the Albert as he reached out for the rat. And 1 week later, when the rat was presented, Albert began to reach out, but then withdrew his hand to grab the rat. Tests over the next few days showed that Albert reacted emotionally to the rat's presence, and there was also generalization of fear to the rabbit, dog, and fur coat. This is the another example of emotional reaction conditioning. A learning chain can start with a dentist drill. This drill causes fear of dental chair for someone, which then creates anxiety about the magazines in the waiting room. So magazines were conditioned with the fear of drilling. Later, this anxiety can make someone uncomfortable when they see a similar magazine at a friend's home, where no such drilling machine were there, and the person become afraid or fearful because of that similar magazine. These are the examples from the clinical psychology or psychiatric perspective. Fear responds to specific stimuli. You must know that there are disorders which are called as specific phobia. The phobia to a specific subject like spiders or height or something like that. In this example, if you have had a traumatic experience involving loud noise, yeah, there was an experience and that experience associated with loud noises. So your brain might have formed an association between the sudden loud sounds and the impending danger. This is why some people with PTSD means post-traumatic stress disorder, can have intense reactions to seemingly harmless stimuli, like other kind of loud sound can produce the fear response or response of anxiety. Emotional reactions to place, sight, sound, and odor. One can relate the substance use disorder and anxiety disorder. In substance use disorder, when a person who is fond of, for example, drinking alcohol, he will get emotional reactions when we pass by through that road on which the liquor shop is there. Sight of some object which is associated with drinking pattern, like uh, drinking on some specific kind of table, or that table has some kind of object on it. If the person sees that object in future time, then he will get conditioned to that object and may get a response of craving. Similarly, some kind of sound and odor can produce that response. This also happens in taste aversion and food preferences. For example, if one had got food poisoning because of the seafood, the classical conditioning can create strong aversions to the other foods associated with the illness. For example, he had taken the seafood and along with that he also had had salad or some other food which are not seafood, and that person can get aversion to these other foods also. And this happens in a vice versa form also. And on the flip side, positive association can make certain food irresistible. If the experiences are good, then certain food can uh, make you more hungrier. The clinical applications of classical conditioning, the aversion therapy of addiction treatment. Aversive conditioning in psychology or psychiatry pairs an undesirable behavior like drinking alcohol with an unpleasant stimulus, for example, a nausea inducing drug which is known as disulfiram. When this disulfiram is given and the person consumes alcohol, he gets the nauseatic feeling and vomiting. So the goal is to create a negative association with the addictive substance or behavior by the means of this aversion therapy. Another is systemic desensitization. In systematic desensitization, there are few steps which are taken to eliminate the anxiety provoking conditioning. For example, in the first step, the therapist and the patient work together to create a list of situations that cause anxiety and rank from least to most stressful for the patient. A person can have anxiety or fear of many things, many situations. So these situations and objects are ranked from least to most. In the second phase, the patient practices relaxation by visualizing enjoyable places like being on a beach or using a cue word such as relax to decondition or to become desensitized from that fear. In the third phase, while feeling relaxed, the client pictures the least anxious scene from their list. This process can be done multiple times before moving on to the next scene or next fearing object. So there are multiple steps can be taken. For example, in uh, case of fearing from a spider, so one can ask them to think about the spider first, and then further then when the anxiety is reduced because of thinking, then person can be given a photo of a spider. In further step, real spider in a closed box is exposed. The fearing person now can hold the box with the spider. Spider crawl on the desk openly. The spider crawl on the shoe. The spider crawl on your uh, trouser, and spider crawl on your sleeve and on your bare arm. So this kind of exposure is given to desensitize the person from fearing spider or any other object or situation. Desensitization can also be done by counter conditioning. So when you think of a calming scene, you feel relaxed. Anxiety triggers are linked with these calming scenes. So relaxation cannot happen with anxiety. By starting with mild anxiety trigger and pairing it with relaxation and then gradually move up to stronger triggers, all anxiety triggers should eventually lead to relaxation. So conditioning is done with the relaxing memories, relaxing movements, or the relaxing pictures in the mind of that person. Now come to the operant conditioning. Operant conditioning is given by B.F. Skinner. He wrote a book, The Behavior of Organisms, which was published in 1938. He had used operant conditioning ideas in areas like school learning, discipline, child development, language learning, social behavior, mental health, medical issues, substance abuse, and job training. So these were the areas where operant conditioning was considered to be applied. So there are two kind of conditioning. One is type S, which we have already known, the classical conditioning given by the Ivan Pavlov. The second one is type R, which is given by B.F. Skinner, known as operant conditioning. And this operant conditioning is, you can say, is learning by doing, learning by your own experiences. In that case, the dog didn't experience himself with that, with those stimuli of food and whistle, a whistle along with food. But here the person himself is the active participant. So there are basic processes of operant conditioning. We will discuss one by one. One is reinforcement. A reinforcer is any stimulus or event following a response that leads to response strengthening. Reinforcer comes into picture when something has done or something has happened. After that behavior, what happens? If you have done good in your examination, there is a praise by the parents. And the praise comes after you got good marks in your examination, and that praise is considered as the reinforcer. Reinforcers are defined by their effects. They cannot be determined in advance, because which reinforcer will work cannot be determined beforehand. When the behavior is strengthened after that reinforcer, so one can say that this is the reinforcer for this kind of behavior. Reinforcers depend on the situation. The basic operant model of conditioning is the three-term contingency. One is discriminative stimulus sets the occasion for a response, which is R, to be emitted, which is followed by reinforcing stimulus, which is SR, or reinforcement. So this follows the model of ABC. Uh, the A is antecedent, B is behavior, and C is consequence. Yeah. Something antecedent before the behavior has happened, and because of that the behavior is expressed, and because of expression of this behavior there is a consequence which may be uh, which may be reward or reinforcer. So there are three types of reinforcement. One is positive, one is negative, and third one is punishment. Positive reinforcement means giving something nice. You know, something is added as a reinforcer, giving praise, giving prize, giving uh, like grades, giving degree, giving chocolates, giving favorite foods, maybe the positive reinforcement. Negative reinforcement means taking something away from the person for a particular response, which means uh, if someone has done some kind of behavior, in lieu of that behavior one cannot watch TV in the evening time. So watching TV in the evening time is removed. This is a negative reinforcement. Although there is a removal, but that removal is may become reinforcer to modify his behavior. That person will try to do the things which is wanted to avoid that removal of the TV watching. So this is a reinforcement. Negative means something is removed, positive means something is added. The third term is punishment. The punishment reduces the chances of a person reacting to a stimuli in the future. It can include taking away a positive reward or adding an unpleasant consequence after a response. So this can be considered as punishment also. In this table, we will learn what are positive reinforcer, what are negative reinforcer, and what is punishment in terms of present the negative reinforcer and removing the positive reinforcers. For example, teacher gives a independent study time to a student L, and L studies in that time. So teacher praises L for good work. This is a positive reinforcement. Something is given. In another example, teacher gives independent study time. Again, the student studies. Teacher says L does not have to do homework. So this is removing the negative reinforcer. The reinforcer is removed and that is negative, which means the child has not to do the homework. To sustain this not to do the homework, the child may uh, do the wanted behavior more frequently. The third example is teacher gives independent study time and student wastes the time and teacher gives the homework. So presenting negative reinforcement, negative reinforcement. In the last, teacher gives the independent study time. Again, the L wasted the time. Teacher says L will miss free time. In the third example, something was given. In the fourth one is something is removed. Okay. Extinction also works in operant conditioning. Extinction happens when a behavior weakens because it is not rewarded. For example, students who often raise their hand but are never called on to answer something may eventually stop doing so. Similarly, people who frequently email someone without getting a response might give up on emailing that person or phone call. The speed of extinction depends on how often the behavior was previously rewarded. If there were only few rewards, extinction happens quickly. If there were many rewards over time, the behavior lasts longer. And this rewarding system also can be correlated with the mobile games. If you are keen to play mobile games, there are certain kind of rewards which are given to pass on the stage. So you have to earn something like coins or some gadget or some weapon or something else to surpass the previous level of games. These rewards are given on daily basis also, weekly basis also, quarterly basis also. So you keep on engaging with that mobile game to waste your time. You know. In the basic processes, there are primary and secondary reinforcers also play into the picture. Primary reinforcers are like things like food, water, and shelter, which are essential for survival. These are the basic requirement of a human being. Secondary reinforcers are linked to primary reinforcers through conditioning. For example, a child's favorite glass for milk becomes a secondary reinforcer because it is associated with milk, a primary reinforcer. Primary reinforcer is milk and that favorite glass. है ना, मैं तो इसी गिलास में पीऊंगा, किसी दूसरे गिलास में दिया तो नहीं पीऊंगा. So this becomes the secondary reinforcer. A generalized reinforcer is a secondary reinforcer that connects with the multiple primary reinforcers. In the secondary reinforcer, there is only one thing which was connected is milk. Now in the generalized, it is connected with the, for example, a person often works long hours to earn money, which is a generalized reinforcer. In lieu of this money, one can purchase various reinforcers like food, house, TV, vacations. So generalized reinforcer is working long hours. Operant conditioning helps explain how social behavior develop and persists with generalized reinforcers. Children may act in a way to get adult attention, which is reinforcing because it is linked to a primary reinforcers like food, water, and safety. In terms of education, important generalized reinforcers include praise from the teacher, high grades, privileges, honors, degrees, distinctions. These are often connected to other generalized reinforcers such as approval from parents and friends. Money as a college degree can lead to a good job. Now comes the Premack principle. What is Premack principle? Premack principle is to rank the reinforcers. For example, to apply the Premack principle, a teacher might say to a child, after you uh, finish reading this book, you can go to a media center or to a library. You can have more library points. You can go to an art gallery or you can go to a computer lab. So these are the number written on these pictures are 6, 1, 2, 3, and the total is 10. After 10 such events of reading book, the child goes to the media center 6 times. So by this method, one can figure out which is the strongest reinforcer for that particular person. Now punishment. Punishment reduces the chance of reacting to a stimulus in future. As we have seen the example of two example of punishment, one was positive and negative, but the punishment reduces the chance of reacting to a stimuli in the future. It can include taking away a positive reward or adding, we all know. Punishment doesn't completely remove it. Once the threat of punishment is gone, the behavior might come back. Until there is a threat of punishment. For example, a child may figure out or may become neutral to the punishing behavior. The child may become more aggressive towards the parents, or if the punishment, the threat of punishment is gone completely, the child in younger age may found smoking in front of their parents. So common punishments including losing privilege, being taken out of the classroom, suspensions and expulsions. However, there are many alternative to this punishment. What can be the alternative? One can change the trigger. If the separate the misbehaving student from other who are also misbehaving. So two students can be separated. So trigger to both of them is somewhat diluted. Let the behavior persist. Allow the student who is standing when they should be sitting to keep standing. This is the Guthrie's fatigue method. Eliminate the unwanted behavior. Disregard minor misbehavior so it doesn't get attention from the teacher. Do not give attention to the minor misbehavior. Encourage a different behavior which supports the positive learning. A wanted behavior can be encouraged, so this wanted behavior will increase in frequency and the unwanted behavior should be ignored so that get reduced in frequency. There is generalization in operant conditioning, and in context of clinical psychology, there is a group known as Alcoholic Anonymous. The Alcoholic Anonymous group is the group of people who were in the past were dependent on the substance. Alcoholic Anonymous for the person who were dependent on alcohol. है ना? By virtue of this Alcoholic Anonymous, and this is basically the principle of generalization in operant conditioning, which suggests involve others in program that promote behavior change. So these past drinker can become a role model, can be deeply connected with the person who are dependent currently. So they can understand their problem together. Let person know that they can achieve high performance by seeing these persons. Teaching person to assess and track their own behavior. Remove artificial rewards like points and use neutral rewards like privileges encourage person to help decide which behavior to reward and how to reward them, help person see how changing their behavior can lead to benefits by connecting changes in their interest, provide reinforcement for person in various environment to help them understand the difference between rewarded and non-rewarded situation, train regularly to continue supporting the behavior development of person who transition from special classes. So the principle of generalization is used in anonymous groups. Again, the discrimination is opposite of generalization in operant conditioning. It means reacting in different ways, either stronger or weaker, based on the specific stimulus or characteristic of a situation. To teach discrimination, we should reward the desired response and ignore the unwanted responses. Studies on motivation reveals that students who adaptively manage their mistakes are more likely to continue work on tougher tasks compared to those who have learned without making an error. So failure is the pillar of success, some used to say. Now let us explore how operant conditioning leads to change in behavior, as this has significant effect on learning. The method focuses on rewarding behavior that gradually get closer to target behavior. To shape behavior, one should follow the sequence. The sequence is, the first is find out what the patient can do right now. Define the behavior you want the patient to achieve. Look for rewards in the patient's surrounding. Divide the desired behavior into small steps to learn one at a time. Help the patient progress from their current behavior to the desired one by rewarding each small step they take towards it. So this basically has role in personality disorders, stressful, the disorder of stressful situations, and can also be implied in psychotic cases also who are having negative symptoms like in schizophrenia. So this behavior modification has been used with both adults and children in various places like school, therapy sessions, jails, psychiatric setups. So behavior modification is not only for the children and younger population. This can be implied on the parents also for effective parenting. Punishment is not commonly used in the behavior modification, and when it is, it usually means taking away something positive instead of adding something negative. Behavior modifiers usually consider three main points: which behavior are harmful and which one should be encouraged or reduced, what environmental factors currently support this behavior, either by keeping bad behaviors going or making it less likely to show better ones. Okay. What changes in environment can help alter the person's behavior. So these are the questions should kept in mind to imply the behavioral modification. So this model, which is known as cognitive behavior modification, there are various type of therapies like cognitive therapies, behavior therapies, and a combined therapy is known as cognitive behavior therapies. So thought of one person cannot be ignored, and these thought can lead to the feeling of anxiety or feeling of other kind of negative emotional reactions, and this reaction may lead to a behavior which is maladaptive. This is a cycle of thought, feeling and behavior which is considered in cognitive behavior therapy for certain kind of psychiatric illnesses. In summary, we have learned that behaviorism, particularly through conditioning theories, was the leading approach in learning psychology. These theories focuses on how learning occurs due to environmental factors without need to consider mental process to understand how behaviors are acquired, maintained and generalized. Key figures in this field include Thorndike, Pavlov, Guthrie and B.F. Skinner. Thorndike proposed that response to stimuli become stronger when they are followed by rewarding outcome, while Pavlov showed through experiments that response could be conditioned by pairing different stimuli together. Guthrie suggests that close relationship between a stimulus and a response leads to their connection, and B.F. Skinner in operant conditioning shows that the participant is the active one to act upon, which is based on the idea that environmental features acts as a signal for behavior. Thank you. So, good morning to all. For recap, in the last lecture we had behavioral learning theories in which we had learned about the connectionist, operant conditioning and Pavlovian classical conditioning. Today we are going to discuss about cognitive learning theory. So we know about the what the behavior is, and cognition is a technical term. First we got to know what is the cognition and what are the technicalities remains around it. To start with, what is cognition? Cognition is a mental processes to absorb and retain information through experiences, through senses. We have five sense organ like eye, ear, nose, tongue and skin, and thought is known as cognition. What are cognitive functions? By virtue of this cognitive ability, we have certain kind of functions which can be attention, pattern recognition, problem solving, memory, learning, decision making in a situation, language processing, perception, imagination, logical and strategic thinking are governed by these cognitive processes known as cognitive functions. The process refers to mental activities that enable us to engage with our environment and make sense of our experiences. So this is bidirectional communication between the environment and the person, cognition of the person, by virtue of which they make out certain thought process and behave in accordance with that. Cognition, a term that refers to thoughts, are frequently perceived as primarily verbal in nature. What we use to speak is our reflection of thinking process. But there are other terms also like auditory imagery, like talking to self within your mind or talking to yourself with your own imaginary world. So auditory imagery is also the part. Visual imagery, mental images you make because of some thought. Kinesthetic imagery, mentally experienced bodily sensations. The sensations are experienced mentally, but actually these are not there. It is important to note that term cognition with an S generally pertains to thoughts, while cognitive processes, functions, or abilities refers to the various other processes which is outlined below in next slide. So the functions, processes, abilities and related concepts are, we are not going into detail of each terminology, but which is not very common, we will discuss in short. The terms related to these functions, processes, abilities and related concepts are sensation, perception, learning, memory. These are the obvious things, and one is gnosis. Gnosis is ability to recognize things you have already learned via senses. Yeah. Like people, car, food, any kind of object. Praxis is ability to move your body in meaningful and goal directed ways. Praxis, I think you must know because of the mechanics of musculoskeletal system, you must know about the praxis. है ना? Like eco praxis. Thinking, processing speed, and priming. Priming is the influence of something on the future cognition. So, attention and salience. Salience is ability to focus and make something more pronounced through words, attention, and memories. Obviously, observation, vigilance, awareness, heuristics like learning moves in the chess, like predicting the further moves after the one such of cognitive learning. What the future moves will you take or what will happen in near future. Biases, perspectives, and mental rotation. Creative cognitions, spontaneous cognitions, social cognition, auditory cognitions, visual cognition, and metacognition. Okay, these are the words related to cognitive functions, process, abilities, and related concepts. Now we will learn three things in cognitive theories of learning. The one is cognitive learning theory, cognitive behavioral theory. There are two theories. One is learning theory, one is behavioral theory. The third one is cognitive behavior therapy. So what is cognitive learning theory? In 1930s, Swiss psychologist Jean Piaget established cognitive psychology as a different approach from behavioral psychology. So behavioral learning came first, then the cognitive learning came into picture after Jean Piaget. He introduced the concept of schemas, which are units of learning that develop throughout the person's life, forming their unique way of understanding the world. Cognitive learning theory focuses on how our brains take in, store, and use information. So this is the cycle. What you see, what your brain takes in as a uh, as an auditory stimuli, as an visual stimuli, or other kind of stimuli, and store that information and apply in the newer feature. The cognitive learning theory involves metacognition. Metacognition means thinking about thinking. It has three components. One is comprehension, second is memory, and third is application. Comprehension means understanding what is happening around, memorizing those happenings, and applying these new knowledge in everyday situations, such as through hands-on activities, writing, discussing topics, and other aspects of your day-to-day life. The process of application of knowledge enhances understanding as fresh information and experiences coming, and creating a continuous cycle can be considered as loop of learning. This happens inside the mind, but they are influenced what we sense from the outside world. So this is again bidirectional communication between the environment and cognition of the person. Now examples of cognitive learning. One is experiential learning. This we will take in the fourth lecture for learning theories. And in short, the experiential learning is practicality. What what the practicality teaches a person a lot better than learning from traditional literature. So practical, the much you do the practical, you learn more by yourself and gains valuable experience in return. So this is learning by doing. More and more you practice, you will gain more and more knowledge. Through the cognitive technique of experiential learning, you can draw important lesson about life from other people and experience from yourself. So this experiential learning is the learning from your own experiences and the experiences of other. No. What you experience in your life uh, maybe a kind of slow learning in this context, but when you learn from the others experience who have robust experience of his life like 20 years 40 years, then you can gather more information in shorter period of time. So it enhances your ability to evaluate and think critically about your experience as well as your ability to connect it with earlier experiences. Another term is recall. Active recall is a great way to improve long-term memory. Instead of just reading or rereading the notes, when you repeat the things in your mind, it will help you retain the more and learn more about the topic. By trying to remember information without looking it up, then they strengthen the brain connection related to that memory. When you repeatedly recall the subject or recall the topic or recall your behavioral experiences in your life, it makes more connections in your brain, which enhances the learning. Another is explicit and implicit learning. What is explicit learning? When a person actively looks for knowledge from external source, there is active participation of the person. This is the most typical form of learning, requiring a conscious effort to gain new information and skill through organized methods like this formal class, formal education, reading texts, reading magazines and other material, attending class and participating in training session. So this is actively learning. You want to learn something from these methods. In implicit learning, what happens is it is an automatic process where you don't realize that you are learning until you find out later that you have remembered something. Yes. For example, when a child learned how to talk, when he started walking first time, eating and typing without need to look at the keyboard is kind of implicit learning when the person gets to know about it later on. Simulation. Nowadays, simulation is more into the picture in learning methods in everywhere in colleges, universities, and institutions. We all already have the simulation lab in the medical college also. One fine example is of training of jet pilots in simulated environment or training of train drivers, loco pilots in simulated environment. Simulation is also a kind of cognitive learning. Creativity, obviously, creating things by virtue of your own knowledge and try to invent new things. What are the benefits of cognitive learning? It improves problem solving ability, helps individual to learn new concepts at a faster pace, develops a deeper understanding of newer concepts. It helps individual boost their confidence, equipping them to handle complex tasks and situations. Individual can learn to develop their creative thinking skills through cognitive learning, which promotes innovation. Now, what is cognitive behavioral theory? We have talked about the cognitive learning theory. What is cognitive behavioral theory? So, behavioral theory comes into picture beforehand the cognitive theories. Now, the behavioral theory and cognitive theories are combined together, is known as cognitive behavior theory. So, this theory leads to the well-known therapy, cognitive behavior therapy. You must maybe know about this in a shorter form called as CBT, and it was created in 1960s by Dr. Aaron T. Beck. This theory suggested that our thoughts and feelings are closely connected to our behaviors. So, in simpler means, the cognition and behavior do not act independently uh, while they are connected to each other actually. The feedback loop here is one of the external stimuli affecting bodily and mental sensation, in which turn affect behavior. So what is going in the mind of a person can affect his behavior, or vice versa. Behavior of the person or behavior in the environment can change the thought process of that person in a positive way or in the negative way. So as a therapist, we will talk about the uh, abnormal thinking process and the consequence of it, and how to correct by virtue of cognitive behavior therapy. So this is the pictorial representation of the loop. There is a thought which may lead to a certain kind of behavior, and this behavior can lead to a emotion like anxiety and depression. The cycle can be start from anywhere from emotion, behavior and thinking, and may go into any direction. So main idea of this theory is wrong thinking leads to emotional pain, and this make people disconnected from reality, and causing them to suffer mentally from their own made up maladaptive thinking process, or can be considered as lying to themselves. This is again the pictorial presentation. You can see in the top of the picture there is a situation. For example, a person is criticized at work. Then a thought comes in his mind, I am not good enough, and that leads to an emotion that I am worthless, or patient may feel anxious, may feel anxiety, and this lead to a behavior. He started avoiding contact with others, and the physical reaction was he feeling tired. There will be loss of appetite, and this cycle continues. Then again, this automatic negative thought strengthen, and the vicious cycles goes on. We will also learn by the examples in next few slides. So keep in mind there is a situation which provokes a thought which is negative, and that leads to a emotion of anxiety and to the avoidant behavior, and this avoidant behavior is uh, now converted into tiredness and loss of appetite as physical symptoms. This is the Aaron T. Beck's cognitive triad for depression. So, because of the certain situation, the person started thinking negative view about the present. The things are not good. The present is not so enjoyable. Then the person started viewing the negative view of the future, and this negative view of future leads to negative view about oneself. So there are three things: the present, the future, and oneself. This is the cognitive triad of depression of Dr. Aaron T. Beck. The fundamentals of Dr. Aaron T. Beck outlined in three levels of cognition. One is there is a core belief you can say, thought of that cycle. Core belief, also known as schemas, are strong beliefs about ourselves, अपने बारे में, the other people, दूसरों के बारे में, and the world around us. These beliefs are usually formed early in life. For example, about the self, the person may start thinking, I am useless. For others, the world is unfair, and the future, things will never work out for me. है ना? So, I am useless is psychopathology can be considered as worthlessness. The world is unfair. This may be converted into helplessness as a feature of depression. You must know, and the things will never work out for me. The pessimistic view of future, which is also one of the part of depressive criterias. So, after belief, core belief, there is dysfunctional assumptions. Out of that belief, what the person starts thinking, dysfunctional assumptions are strict conditional rules that people follow in their lives. These rules can be unrealistic and harmful. For example, someone might believe that it's better not to attempt something than to risk failing. This is in the another context. If there is fear of failing in a task, the consequences, do not attempt that task. So this is kind of a negative thought process. We had talked about the negative automatic thoughts. So negative automatic thoughts are thoughts that come up without effort in a specific situation. So these are automatically comes into the mind when a person land up in a situation. For example, in depression, these thoughts usually focus on negative feelings like low self-worth and feeling worthless. For example, when confronted with a task, if a task is given to the person, a negative automatic thought might be, I will fail. You know, in anxiety disorders, automatic thoughts often involve thinking the risks are much higher than they are and doubts one's ability to handle the challenges. For example, in the social anxiety disorder, so they may thinking of non-performing adequately in the social situation, the person may feel anxious because of the automatic thought of I will fail or I will not perform. So this is real life example of cognitive theory. The example one is character is Rajesh was a passionate runner. On the day of event, as the race progressed, he began to experience discomfort in his knee. He ultimately found it necessary to cease running entirely. There was an event, there was a situation. So the situation is the Rajesh failed to complete the race. Now he began to believe that he was not an effective runner, that his training effort had been in vain. Whatever the training he took is not adequate, that he would never reach his objective of finishing marathon. So these are the negative thoughts leads to decreased confidence and discouragement. So this is uh, uh, the situation leads to the thought, and thought leads to the behavior, which is he stopped running altogether or practicing altogether regarding the marathon. So in another example, Sarah is preparing for presentation at work and is feeling anxious. She is having following negative thoughts. The thought is I am going to mess up and embarrass myself. स्टेज पर जाएंगे कुछ बोलेंगे सब कुछ गड़बड़ हो जाएगा and I have to feel ashamed of that non performance. The feeling will be she become nervous and self conscious. The behavior will be procrastinating in preparing for presentation or totally avoiding, try to avoiding the presentation, giving the presentation. So we have understood what is cognitive triad, what is cognitive theory, and what is how the cognitive and behavior are interrelated with each other and leads to various negative automatic thoughts and can lead to impairment and distress in the life of the person. Now what we can do is we can do the CBT. We have to we have to so let's understand about the cognitive behavior therapy, how it works. Basically, CBT focuses on teaching. CBT does not suggest anything to the person. It focuses on teaching, and patient has to become their own therapist. The therapist just only give the guidance, and what the person has to do by on his own. Certain kind of tasks, certain kind of exercises, or certain kind of surveys may be given to the person to conclude that whether the things are right or wrong. Whatever he is thinking is right, the negative automatic thoughts are right or wrong. It helps them understand their current thoughts and actions and provide tools to change unhelpful thinking and behavior pattern. How it will work, we will discuss in next slides. It focuses on solving the current problems, and certain goals are set to reverse the vicious cycle of negative automatic thoughts and behavior and their consequences. In cognitive behavior therapy, the goals which have to be given to the person should be smart. Smart means the goal should be specific, the goal can be measured, the goal can be achieved, the goal should be realistic and time bound. For example, a goal for someone with obsessive compulsive disorder. Do you know about the OCD? Obsessive compulsive disorder might be to cut down hand washing from 5 hours a day to 1 hour a day within 3 weeks of therapy. So this is one of the goal which is specific, which is measurable, can be achieved within 3 weeks and is realistic and time bound. This is in the context of obsessive compulsive disorder and can be used in various other psychiatric disorder and psychological problems. So in CBT, first is to target the maladaptive core belief. One is to target the maladaptive, the negative view of himself or environment is to be targeted. Thought records are used to make a patient aware of their NATs. The person has to make a record of the thoughts, and the therapist want to find out the negative automatic thoughts and can be taught to the person what is happening. Behavioral experiments are mainly used with anxiety-based mental health disorders. What is behavior? The behavior is usually avoidant behavior or anxious behavior. So behavioral method, for example, if the person is fearing of height, that person in a graded manner can be exposed to the height, so the person anxiety gradually goes down. For example, if the person is having fear of height, the person can be taken to second floor, then to the fourth floor, then to the sixth floor, observing that at each and every step the anxiety of the person is normalizing. Then one have to move to the next step. This may also be helpful in the case of athletes and sports. Now remember the case of Rajesh, an marathon athlete. So therapist has had set a realistic goal for him. The Rajesh Mark set new, more achievable goal for himself. He started celebrating small wins, engaged in positive self-talk, joined a running group, and tracked his progress by monitoring or by technical means also. So what happens is, in new thought, with this consistent effort, he started thinking, I can improve my running and achieve my goals. New feeling is optimistic and motivated. New behavior is Mark starts incorporating interval training into his runs and sets a new goal of running a mini marathon in few months. Despite of going to a full marathon, he thought that I will first go for a mini marathon. So in this graded manner, his anxiety reduced, his avoidant behavior is vanished, and he started taking participation in improving himself for full marathon. In the second example of Sarah, After practicing relaxation techniques and challenging her negative thoughts, she starts to think more positively. What the thought had been changed, that I have prepared well and known my material by doing good exercise, by knowing the basic knowledge of that presentation and studying hard and doing practice and rehearsals. Now she started thinking, I can do this. The feeling is she is confident and calm. The behavior is practices the presentation and delivers it successfully. Okay, how this cognitive behavior therapy works for maladaptive behavior and thought process. So, what is the scope of this CBT? This CBT can be used in various psychiatric disorders like depression. The recommendations are for mild to moderate. It can be used alone therapy, and moderate to severe. It can be combined with antidepressant medication, and it can be used for relapse prevention also. It can be used in generalized anxiety disorder. You know all about generalized anxiety disorder. The class must be done for anxiety disorders in the previous lectures. No, I will tell you later. Panic disorder. No, obsessive compulsive disorder. You all know. You know about the post-traumatic stress disorder. Yes. Yeah. So all cases, including mild to moderate cases, are the target of CBT and can be benefited by this therapy. In summary, the cognitive model suggests that how people feel and act is shaped by the apperception. Apperception means their own perception of the situation, how they treated this situation, how he or she looked upon that situation. For example, in the case of Rajesh and Sarah, they looked the situation in a negative way. But therapists of these two are positive. He looked in another way. So cognition has three levels. It has core beliefs, dysfunctional assumptions, and negative automatic thoughts. Formulation fits a person experience into cognitive behavioral framework. One have to fit this experience into cognitive behavioral framework. And the CBT is focused, time limited, and involves teamwork to accomplish the task. CBT uses cognitive method like guided discovery, Socratic questioning, along with the behavioral method like activity, scheduling, and experiments are given to the person. It is case to case dependent. For example, in panic disorder, what the notion is, in the panic disorder, the attack is mimicking like a myocardial infarction or heart attack, but it is not heart attack. So that person can be given task to see the prevalence of that disease, what are the factors which can lead to this thing, and how many attacks can how many myocardial infarction attack one can have in his life, because in panic disorder there are many attacks of this kind in this in their life, and they think that these are because of the cardiac issues. But what is the general consensus? A one person, how many attacks can he have? Three. You know. So this is how their thinking is changed, by experimenting, by explaining, by giving tasks. Many studies shows that CBT is effective for various mental health issues, as we have already discussed, from depression to PTSD. It is helpful. Now, thank you. Previously, we had learnt about the behaviorism, and particularly through conditioning theories was the leading approach in learning psychology. These theories focuses on how learning occurs due to environmental factors. We have learned about the learned about the operant conditioning, classical conditioning, and behaviorism. And the key figures in this field include Thorndike, Pavlov, Guthrie, and B.F. Skinner. In the second series, we had learnt about the cognitive model. Cognitive model has three levels: the core beliefs, dysfunctional assumptions, and negative automatic thoughts. Formulation fits a person's experience into cognitive behavior framework, and which leads to cognitive behavior therapy, which aims to change cognition and what they do, means behavior. Now coming to the constructivism. Constructivism is a viewpoint that suggests people create much of their own learning and understandings. They create their own understandings by engaging in experiences and interacting with other peoples, and further combining new information with what they already know. So two figures are important in this constructivism theory. One is Swiss psychologist Jean Piaget, and other one is Vygotsky. We are going to learn about these scientists and their theories. These theories highlight the importance of how knowledge is constructed, which is the key to constructivism. The assumption and perspectives of constructivism. Many researchers and practitioners think that the only cognitive theory do not fully explain how a student learns and understands. The queries are: thinking resides in the mind rather than in interaction with persons and situation. Process of learning and thinking are relatively uniform across persons, and some situations foster high order thinking better than others. We will learn about the situation cognition further in the slides. Thinking derives from knowledge and skill developed in formal instructional settings more than on general conceptual competencies that result from one's experiences and innate abilities. So this is a kind of bidirectional interaction between the person and the environment, which is the main feature of this constructivism. So what is constructivism? Constructivism is not a theory, it's an epistemology, which is a philosophical view on how learning happens. But a theory provides a scientifically valid explanation for learning by development of theory uh, by virtue of various standardized procedure, like creating a hypothesis and proving that hypothesis is null or actually true. Constructivism does not claim that there are learning principles to be found and tested. Constructive Constructivist theorists do not believe that scientific truths are out there waiting to be found and confirmed. They think that these truths are already there, and that cannot be tested, and that are found naturally in the environment. The world can be understood in various ways, meaning no single theory holds the absolute truth. This is the words of constructivist theory, and actually this truth is also applies to constructivism itself as well. Means constructivism is also not a single theory by virtue of which one person learns. Perspective of constructivism. Constructivism is not a single viewpoint, but rather as different perspectives. For example, exogenous constructivism, endogenous, and dialectical. In exogenous, the acquisition of knowledge represents a reconstruction of external world. The world influences the belief through experience of the person, exposure to the models, and teaching. Knowledge is accurate to the extent it reflects external reality. So, in endogenous constructivism, knowledge derives from previously acquired knowledge and not directly from the environmental interactions. Knowledge is not a mirror of the external world, rather it develops through cognitive abstraction. So it's a knowledge which is already known to the person and applied for further enhancement. In dialectical constructivism, knowledge derives from interaction between person and their environment. Constructions are not invariably tied to the external world nor wholly the workings of the mind. So it says it's a kind of bidirectional interaction between the person and the environment. Situated cognition. Situated cognition or situated learning focuses on the connection between a person and their environment. It shows that thinking is not just something that happens in our mind, it also plays a role in motivation, which influenced by how we think and interact with social and educational factors, including language. This concept aligns with the constructivist view that learning is deeply connected to context. Context means situation, and this has been increasingly supported in various subject areas. Contribution and applications of constructivism. Social environment and cultural background plays a significant role in shaping mental disorders. The cultural aspects impacts the culture impacts various aspects of mental health, including the stress they face in their life, the willingness to seek help for the problem, the kind of help they pursue in the future, and the symptoms they report, and their coping mechanism and social support system all plays a role in a development of and resolution of mental health problems. Similarly, the cultures of mental health professionals and the services they provide also affect the mental health care. So the person who is suffering is not only into the play, the mental health professional is also into the play, and their mindset and cultural backgrounds and their understanding also plays a role. For example, terms like depressed and anxious may not exist in some American Indian and Alaska Native languages. Therefore, assessing the need for mental health services among these groups require a careful understanding and their cultural context. Social constructivism focuses on several key areas regarding mental disorders. It focuses on the disorder themselves and the collection of symptoms, the lived experience and feeling related to these disorders, the characteristics that define them as mental disorder, and how patient express their experiences and communicate with the clinicians. So both remains into the play. The think about Now think about someone diagnosed with PTSD, known as post-traumatic stress disorder, which means they are recognized as having a mental disorder. For this person, it includes the PTSD condition itself, along with the background, such as what caused it and what triggered it. Means, as the name of the disorder itself says, that post-traumatic, that some trauma or stress has been there in the history, and that lead to development of a disorder known as post-traumatic stress disorder. Their personal feelings and experiences and possibly unique characteristic along with a range of symptoms that shows they have PTSD. So collection of symptoms, the disorder themselves, the experience of the person and feeling related to the problem, all are there to say that the person is having a mental disorder. So being diagnosed with and treated for PTSD usually means the patient needs to work with the clinician. The patient will share his or her experiences and feelings and describe her symptoms in a specific manner. And the clinician in turn must interpret the patient's observed and reported behavior, both verbal and non-verbal, and come to a conclusion to make a diagnosis. Each of these targets can be seen as influenced by social factors, information about a person's cultural background, such as their religion and possibly their gender identity, should guide diagnosis, the interaction between clinician and the patient, and treatment. One key reason to assess cultural background is that differences can lead to confusion and misunderstanding. So, cultural background should must also be kept in the mind while uh, tackling with these patients. So as we have said that there is a situation and that lead to a cognition and certain behavior. Uh, so there are some sort of disorder which are defined in ICD-10, which used to happen after some kind of event, and these disorder are related to reaction to severe stress and adjustment disorder. The subclassification is acute stress reaction after a catastrophic event. Post-traumatic stress disorder is late onset disorder to acute stress, and adjustment disorder is disorder of adjustment to new environment. So these all these are situation specific. Now coming to the Piaget's theory and stages of cognitive development, the key features of Piaget's theory are following, and he also used the constructivist approach to learning, so it is important to learn about him. The key features of Piaget's theory are developmental stages. He identified four stages of cognitive growth that occur in order, with each with unique ways of thinking from infancy to teenage years. In constructivist approach, children learn by actively exploring their surroundings, like little scientists. Instead of just taking in information passively, they are also active person. Schemas, these are mental structures that help organize knowledge, increasing in number and complexity as children grows, which helps them understand the world better. The assimilation, this is the process of adding new information to the existing schemas. So new information always added to the previous information. Accommodation, this involves changing current schemas or creating new ones to incorporate new information. Equilibration, this is balancing act between assimilation and accommodation that helps children move through cognitive stages, resolving conflicts and adopting new ways of thinking. So these are the four stages of Piaget's development. First is sensory motor, um, which occurs between birth to 18 to 24 months of age. The goal is object permanence. Object permanence means the children start to realize that people are separate from them and the object still exists. This means if the parents are not there, they are in the another room, they still exist, and even they are hidden. Pre-operational 2 to 7 years, symbolic thoughts start to develop. The child start to see the world as the other does. Concrete operational 7 to 11 years, logical thoughts start to occurring, and they begin to think about how other people might think and feel, which is separate from their feeling and thinking. Formal operation is adolescent to adulthood. Scientific reasoning start to developing. They gain the ability to think abstractly. Now, Vygotsky theory of cognitive development. Vygotsky somewhat uh, the difference between Piaget and Vygotsky theories of learning are as follows. There is a strong emphasis on socio-cultural context in Vygotsky theory. Social constructivism is more emphasized rather than cognitive in the Vygotsky theory. There is no general stages of development as given by the Piaget. Zone of proximal development, scaffolding, language, and dialogue plays a role in development of in the learning of the child, and tools of the culture are also important. So, the teaching implications of Vygotsky theory is to establish opportunities for the children to learn with the teacher and more skilled peers. While in Piaget's theory, it supports children to explore their world and discover knowledge by themselves. Now, coming to the theory of cognitive development, first we discuss about the socio-cultural theory. Vygotsky thought that the culture and the social factors shape cognitive development. He highlighted how social interaction helps children develop mental skills like speech and reasoning. So, social interaction with other, like parents and other relatives and peer group, uh, highlight the development of learning in the child. So, a teacher, parent, coach, or friend who helps guide the child and shows them how to learn new skill is lies under the socio-cultural theory. Now, coming to the effects of culture, so people do not just passively receive knowledge; they actively engage with their surroundings. This engagement, along with natural skills, social connections, and cultural resources, is essential for cognitive growth. Infants come into the world with basic skills of thinking known as elementary mental functions. These mental functions are attention, sensation, perception, and memory. As they interact with their social and cultural surrounding, these basic functions grows into more advanced, higher mental functioning of like reasoning and abstract thinking. So there is a term more knowledgeable other. The more knowledgeable other is term that describes someone who knows more or has a greater skill than the learner in a specific area, not in the all areas but in the specific areas. Through conversation with these knowledgeable individuals, learners receive guidance, tips, and motivation, helping them understand how to accomplish the task. And interestingly, the MQ, the more knowledgeable other, doesn't have to be a person. It can also be a tool, an application, or AI tool, or robots and machines. Uh, by help of these things, one can learn more. Many companies are now implementing electronic performance support system and to aid employees in their learning. Additionally, electronic tutor are also being utilized in schools to enhance education. In the recent news, a robotic tutor was employed in a southern part of India as a teacher. The exact I am not remembering, but there was a news. Now, zone of the proximal development, which is also a part of Vygotsky theory. Vygotsky described the zone of proximal development, ZPD, in the short, as the space where effective teaching and support should happen. This helps children learn a skill they can use on their own later and promoting advanced thinking abilities. So you can see the picture in the right hand side. There are three circles, and the central circle is the things the things which the learner can do unaided means by themselves. And in the second zone, this is the zone of proximal development. Learner can do with the guidance of others like teachers, friends, and or other means of tools and applications. And the outer circle is the thing which the learner cannot do by themselves or with the guidance. Internalization of knowledge. Internalization is the key idea in Vygotsky theory, connecting social interaction with personal cognitive growth. It is the process by which external activities influenced by society transform into internal mental process, helping people learn to knowledge and skill. Vygotsky believed that advanced mental abilities like language, reasoning, self-control start from the social interaction, not in the mind of the child itself. A child figuring out a problem with the parents help doesn't just remember the answer. They build their understanding by talking and engaging with their parents. So this is a bi-directional exchange of the knowledge. Vygotsky also emphasized on the language. Now we will learn how it is important in his theory. So, language plays two critical roles in cognitive development according to Vygotsky. One is cultural sharing of knowledge. Language is the main way to share cultural knowledge, values, and practices from one generation to the next. It is obvious. Language is a strong tool for mental growth. Language is more than just a way to talk. It help us to think. It supports the growth of advanced thinking skills like abstract reasoning, planning, and solving problems. Vygotsky differentiates between three forms of language. One is social, then private, and the inner speech. In the social speech, this is the first type of language helps children connect with the others, create common understanding, and take part in cultural activities. And it usually starts around age 2. So this is a visible speech by virtue of which a child is interact with the others. So this is a spoken language. Private speech, this is the speech that children say out aloud to themselves, not to others, which helps them think, typically beginning around age 3. And you must have seen that the children of age from 3 to 12, they used to talk to themselves while playing, or talking to the imaginary companion. So this is the private speech. Inner speech suggests that private speech doesn't vanish. Instead, it becomes the silent inner speech, usually developing around age 7. So this is the speech which is not spoken aloud to others or to the self, but it runs in the mind of the child. So in their mind, they used to speak to themselves. Functions of private speech. Children use private speech to work with themselves, similarly to how adults help them to reach to a goal. Vygotsky views private speech as a tool for children to organize their activities and strategies. which supports their growth. It involves using language to control their own actions. This self-guided conversation assists them in concentrating on what is needed, organizing action to achieve the goal, and tracking their progress of achievement of goal by talking to themselves. Inner speech comes from private speech. Private speech becomes inner speech when it is become less visible. Inner speech is a quiet language we use in our minds to think, plan, and control our actions. The functions of inner speech to planning and problem solving. Inner speech plays a key role in planning what to do next, thinking about possible outcomes, and creating strategies to handle difficulties. Self-regulation and control. Inner speech help us control ourselves by allowing us to resist impulsive action, concentrating on our goal, and handle other emotions and drives while doing some kind of work. Social understanding. Inner speech is connected to our ability to understand other people's thought. By having internal conversation and imagining different viewpoints, we can better grasp what other things feel and intend. These are the important aspects of Vygotsky theory, which includes social interactions are essential. Knowledge is built together by people. Self-regulation comes from internalizing action and thoughts from social interactions. Human growth happens through sharing cultural tools like language and symbol. Language is the key tool evolving from social speech to private speech, then to inner speech. The zone of proximal development represents the gap between what children can achieve alone and what they can achieve with the help of others. Now coming to the social cognitive theory, which is given by Albert Bandura. This is the learning from others' actions. Social cognitive theory suggests that individuals actively shape their learning by understanding the result of their action. This understanding impacts their surrounding and personal traits, which then influence their future behavior. Albert Bandura presented a key viewpoint on social cognitive theory. His ideas have been used in many areas, including personality growth, mental health treatment, workplace training, education, health initiatives, advertising, and more. So he started with a Bobo doll experiment. Uh, in this studies, researcher shows videos to young children of an adult behaving violently towards a large inflatable doll, which is known as Bobo doll. After the video, the children saw the adult either being rewarded, punished, or facing no consequence for their action, means their violent action. Later, the children were put in a room with the same inflatable Bobo doll. Researchers discovered that children who saw the adult being rewarded or facing no consequence were more likely to act aggressively towards the doll. So Skinner suggested that learning happens through personal actions. On the other hand, Bandura argued that both people and animals can learn by observing and copying others. So in this experiment, the children copied the other adult person uh, in a similar manner, whether they were rewarded, punished, or faced no consequence. In his theory, there is a sequence of motivation to act repeatedly. There is a stimuli focus to which the person gives attention, and he retain the information and rehearse the encoded memory. Practice feedback by motor reproduction of their retained knowledge, and the action, the reward reinforces the action to be repeated in the future by motivation. The features of social cognitive theories are reciprocal determinism, behavioral capabilities, reinforcements, expectations, and self-efficacy. So the reciprocal determinism is the main idea in social cognitive theory. It describes how people who have learned experiences interact with their environment, social context, and their own behavior. This interaction helps them respond to different situations and reach their goals. Example, a student who thinks they can do well on an exam is more likely to study hard. This belief in their ability known as self-efficacy, which drives their effort. If they doubt their chances of passing in the exam, they may not study at all. Their actual exam result will then confirm or challenge their belief about their abilities. So this is the reciprocal determinism. The result shapes the future behavior of the child who doubt their abilities. Behavioral capabilities. Behavioral capability is about a person's skill to act based on their own knowledge and abilities. In other words, to perform any action, a person needs to understand what to do and how to do it by their knowledge, previous knowledge and abilities. Reinforcement we have already discussed in the previous lectures regarding the positive reinforcement, negative reinforcement and punishment. Expectations. Expectations are the results a person thinks will happen based on their actions. These expectations often come from the past experience. For instance, a student who lacks motivation to get good grades might not see much importance in doing what is needed to reach those grades. So if you expect good results, you will study hard, and if not, then less hard or not at all. Self-efficacy is the degree of confidence someone has in their ability to carry out a task successfully. Self-efficacy is often said to be task-specific, meaning that people can feel confident in their ability to perform one task but not in another task. Now, the difference between social learning and social cognitive learning. Social learning theory and social cognitive theory are both learning theories that highlight the importance of learning by watching others. Social learning theory centers on reinforcement, while social cognitive theory highlights cognitive process in the mind. Social learning theory suggests that all behavior are learned through the observation, where social cognitive theory recognizes that learning can also happen through the direct experiences. Additionally, social learning theory emphasizes individual learning, while social cognitive theory offers a broader perspective of learning, for example, environment, from the environment. Now, in the summary, we have learned about the constructivist learning theory. The key principle includes active learning, prior knowledge, social interaction, zone of proximal development, and real world context. While in social learning theory, the key principles are observational learning, individual learn by watching others, modeling like teacher, peers, and media can serve as a model to learn. Attention, retention, reproduction, and motivation is the uh, cycle by virtue of which one person repeat their behavior after getting motivated. Reinforcement and punishments, positive or negative outcome influence the likelihood of a behavior being repeated by aftermaths of the work done. Thank you. Good morning to all. In the series of lectures on learning, this is the fourth and last lecture. It is regarding the experiential learning, which is also known as Kolb's learning styles. The David Kolb presented his learning styles model in 1984, which resulted in development of his learning style inventory. The theory of experiential learning consists of 4 stage learning cycles and 4 unique learning styles. A key aspect of Kolb's theory emphasized that learner's internal thought process. He believed that learning involves acquiring abstract concepts applicable in different contexts and new experiences being the catalyst for forming these concepts. So this is the experiential learning cycle, and it has 4 steps. The core concept of both terms is that successful learning happens through a constant process of experiencing, reflecting, thinking, and trying out new ideas. These consists of concrete experience, having the actual experience, reflective observation, reflecting on the experience, abstract conceptualization, learning from the experience, and active experimentation, trying out what you have learned. This is in the details. In concrete experience, the learner has a direct experience. This could be something new or a fresh look at something they already know, influenced by new ideas. For example, a young man conducts his first interview. So let's see what happens in the cycle. Reflective observation of the new experience. Now the learner thinks about his new experience based on what they already understand. Now he is in the interview. It's important to notice any differences between what they what they experienced and what they know. Afterwards, he thinks about what happened, notes his observation of the interview, and talks about his experience with the interviewer. In abstract conceptualization, this reflection leads to new idea or changes in existing one, showing that the learner has gained knowledge from their experience. He reflects on the interview process and his performance, connecting it to the past interview experiences and relevant theories he knows. In the fourth cycle, in active experimentation, the new or changed ideas leads to trying things out. The learner tests their thought in the real world to see the result. He also looks for ways to improve and test out different methods and strategies based on what he learned earlier. In the learning styles, each stage supports and connects with the next. One can start the cycle at any point and continue through its logical order. Effective learning happens when a learner can complete all the four stages of the model. Moving through the cycle helps create more complex and abstract mental models of the subject being learned. Kolb's learning theory identifies four unique learning styles that follow a four-step learning style. He suggests that individuals tend to favor one specific learning style over the others. Different factors shapes a person's preferred style. These can include their social surrounding, educational background, or their basic way of thinking. The choice of learning style comes from two sets of variables and two distinct decisions we make. Kolb illustrated these as a line on an axis, each with opposing modes at the ends. We will see by virtue of the picture regarding the axis. The Kolb's model, the east-west axis represents the process continuum, which refers to how we tackle tasks. The north-south axis is known as perception continuum, relating to our emotional reactions or how we think and feel about a situation. So these are the axes. You can see the learning styles from 1 to 4, that is concrete experience, reflective observation, abstract conceptualization, and active experimentation. So there are two axes in which there are four type of learning styles are there. One is accommodating, another is diverging, assimilating, and converging. We will see in details what are these learning styles. Kolb thought that we cannot use both variables on one axis at the same time, like thinking and feeling. Our learning style comes from these two choices. It often clearer to understand Kolb's learning style using a 2 by 2 grid. We will see the grid in the next slide. Each learning style is a mix of two preferred styles. The grid also shows Kolb's name for the four learning styles. This means diverging, assimilating, converging, and accommodating. So this is the grid line, and you can see there are two axes. One is concrete experience and abstract conceptualization, consisting of feeling and thinking, and on the XY axis there is active experimentation and reflective observation, which consists of doing and watching. If the person is going with feeling and doing, this means he is accommodating the knowledge. If the person is feeling and watching, this means the knowledge is diverging, the learning is diverging. When the person is thinking and doing, this means he is using converging learning style. And the person is thinking and watching, this means he is assimilating the knowledge and the learning style. Now, somewhat in short details, the starting with the diverging, which consists of feeling and watching. These individuals can see things from various angles at a problem. They are empathetic and prefer observing over acting out because of these observations. They like to collect information and use their creativity to find solutions. They excel at understanding real situations from multiple perspectives. Kolb named this style diverging because individuals with this approach excel in generating ideas, such as during brainstorming sessions. Those with a diverging learning styles have diverse cultural interest and enjoy collecting information. They are information collectors. They are curious about others, often imaginative and emotional, and usually have a talent for the arts. People with this style like to collaborate in groups, listen openly, and appreciate personal feedback. Now, what happens in assimilating consists of watching and thinking. The assimilating learning style emphasizes a clear and logical method. For these individuals, ideas and concepts take precedence over a personal interaction. So they are not only observers, they prefer straightforward explanations instead of hands-on experience. So they have explanations, but they don't have hands-on experience on the subject. They are skilled at grasping complex information and arranging it logically. Those with an assimilating style focus less on interpersonal relationships and more on abstract ideas. They are drawn to theories that are logically sound rather than those are practically useful. So their theory may be logically sound because of their knowledge, but may not be practically useful. This learning style is crucial for success in fields related to information and science. In structured learning environment, they favor reading, attending lectures, analyzing models, and having time to reflect their learning and knowledge. The converging one consists of doing and thinking. Individuals with converging learning style excel at applying ideas and theories to real world situations. So they are skilled at problem solving and decision making, focusing on finding answers to specific challenges. These learners are more interested in technical tasks than in social interactions. A converging learning style enhances their expertise in specialized and technological areas. They enjoy experimenting with new concepts, simulating scenarios, and engaging in hands-on application. So these are basically researchers and use the converging learning style. They used to do the experiments and think of the problem. Now the accommodating, where there is a doing and feeling. In accommodating learning style is practical and focuses on hands-on experiences. They do and feel. People with this style trust their intuition more than logic. They often depend on others' insight and like to engage in real-life activities. They enjoy new challenges and experiences, and they prefer to implement plans. These individuals usually follow their instincts, not the logic, and instead of doing detailed analysis. Those with an accommodating learning style often seek information from
others, because they do not analyze, they follow their instincts. uh, they used to seek information from others rather than conducting their own evaluations. This style is common among many people. They used to ask some other expertise to gather the knowledge. So, what can be the application of Kolb's learning style in medical sciences? So, starting with concrete experience. For example, students encounter a real patient in practice and select patients that fit the selected chief complaints. So, a medical student start with this concrete experience. In reflective observation, the selected patients are described by the students, regarding the history of present illness and all. Abstract conceptualization, students present and discuss the patient case with other students and teachers. In addition, relevant skills are reviewed and more in-depth input is provided. In the active experimentation, after all this has been done, in simulation training, student practice anamnesis and physical examination with the standardized patient, while other students and faculty watch the exercise on a video screen and provide the feedback afterwards. So all the cycles are complete, and the students, after having an idea, describing the patient and doing the hands-on practice, and then uh, in simulated environment, presenting the case on standard formulas, they got the active experimentations. So this is the last slide. In the summary of Kolb's learning style, there are four cycles and four learning styles. In four cycles are concrete experience, reflective observation, abstract conceptualization, and active experimentation. The learning styles involves on the basis of these cycle are diverging, which consists of concrete experience and reflective observations. Assimilating consists of reflecting observations and abstract conceptualization. In converging, abstract conceptualization and active experimentation. In accommodating, concrete experience and active experimentation are involved. So thank you. Thanks to all.